Vanderbilt University School of Medicine second year curriculum overview. Students come from all over the globe to study to become doctors. But what does that process look like? If you aren't familiar with our curriculum, it can be a bit of a black box. Luckily, we're here to help. Our unique personalized 4-year curriculum begins with foundations of medical knowledge in the first year, proceeds to foundations of clinical care in the second year, and then finishes with the immersion phase in years 3 and 4. Today, we're going to focus on the Foundations of Clinical Care, or FCC phase in the student's second year of training. In their first year of medical school, students are primarily in a classroom-based setting. By year 2, they are ready to dive deeper into the clinical realm and participate fully in patient care. Here, students will grow in our 6 competency-based domains through direct patient interaction and physician role modeling. To accomplish this, students will rotate through our 6 core clinical clerkships. While the order may be different for different students, they will all rotate through every one of these clerkships. The clerkships vary in length but fit into 5 standardized 8-week blocks. Psychiatry and neurology combine to make one 8-week block, while pediatrics and OB/GYN afford students with an opportunity to personalize their curriculum through 2 2-week electives, which can be in any discipline. Additionally, interwoven throughout this phase are key longitudinal learning elements. These longitudinal elements extend through all 4 years of the curriculum. During the FCC phase, some elements are presented on a dedicated day, while others are directly embedded into the clerkships. One of the unique parts of our curriculum is the ability to tailor it towards a student's interests. Several clerkships allow the selection of subspecialties within their field, and there are those 2 opportunities for clinical electives outside of the clerkships. These choices help prepare the students for the upcoming immersion phase. Additionally, we have several specialized programs. The Medical Scientist Training Program, MSTP, is a combined MD-PhD program focusing on clinical research. The Medical Innovators Development Program, MIDP, allows exploration of transformative medicine through clinical innovation. Students in any of these programs will have requirements on Wednesdays that pull them away from their clinical duties. So, if you are working with FCC students, you may wonder how we assess them. The FCC phase is pass-fail to allow students to focus on learning and growth. This process also allows us to identify students who are in need of more assistance, intervene to improve their skills, and catch them up to their peers. Students request assessments from frontline assessors such as attendings, residents, and nurse practitioners. Students also have individualized observations by our master clinical teachers, specially trained physician educators who provide immediate comprehensive feedback on clinical encounters. We depend upon our frontline assessors to give our students valuable feedback. The milestone assessment should be based upon what you directly observed the student doing. Additionally, timely actionable feedback in narrative form is highly prized by both the students and the clerkship directors. At the end of each rotation, clerkship directors review the milestone evaluations provided by the frontline assessors and ensure that the students have passed the MBME shelf examination. The clerkship director provides a final assessment of each student that includes ratings in the 6 competency domains, notes the student's shelf score, and adds both formative and summative feedback. This holistic approach to assessment promotes the maturation of our students' clinical skills. The FCC phase puts first-year course knowledge into practice. By the end of the year, students have the foundational clinical skills needed to build toward becoming excellent clinical providers. A Vanderbilt University School of Medicine production. Narrated by Travis Crook. Executive producer,
Brenna Hansen.
Vanderbilt University Oh my gosh, already.